Hi, everyone. Welcome back to today's second panel of the Young Security Conference. As you may know by now, the conference acts as a discussion forum between policy experts, young professionals, and academics on matters of European security and defense policy. And now we are pleased to present this panel on health security, and I will be your moderator for this panel. My name is Ambika Varma, and my background is in biomedical science as well as international security, and I often work in this juncture to analyze how security policies are affecting different populations around the world. So before we begin, I'd like to please remind you to follow Europa Nova on Facebook, Twitter, and Instagram, and please interact with our hashtag YSC21 to keep the conversation going. And you can also, throughout our panel discussion, feel free to ask questions and interact with our panelists that I will introduce in just a second. Through Slido. The link should be in the sidebar or in the chat, depending on which platform you're using to tune in, and enter the code #YoungSecurityConference. We'll be welcoming your questions and try to get them answered. So finally, onto the panel. So in the past year or so, I think we've all interacted with health security in some way, shape, or form. And today, we will be talking to policy experts in the field to touch upon what health security is, talk about COVID-19, its direct and indirect impacts on global economies and political stability around the world. And also with their unique experiences, we will discuss the challenges of cross-sectoral cooperation and how health security fits into those traditional hard security paradigms. So without further ado, I will present our distinguished panelists. First, I'm going to start off with Dr. Anja Opitz. She is the president of the Global Health Security Alliance and is a founding member of the Middle East and International Affairs Research Group. She has been consistently a strong voice in the field of global health security and EU defense and security policy, and she is also the head of section for international politics and security policy at APB Tutzing. Second, we have Ms. Christine Strassmayer. She is the vice chairwoman of the Middle East and International Affairs Research Group. She has experience as a security and intelligence analyst in the Middle East, in law enforcement, humanitarian, and private sectors. In the past year, she has also worked on the impact of COVID-19 on political stability and conflict in Asia and East Africa. Finally, last but not least, we have Dr. Stefan Goebbels, a global health security expert at the Global Health Security Alliance. He is also currently the branch head for the international cooperation at the Bundeswehr Medical Service headquarters. And before this deployment, he was the military medical advisor to the United Nations Medical Director in New York. During the pandemic, he has worked as a consultant for African and Asian nations to build up surge capacity. So to begin our panel discussion, I would like to start off to maybe frame the discussion and touch upon what health security is and how does it fit into the traditional security paradigms of hard security. And I think that you will all have very insightful things to say, so I'm very excited to get started. Perhaps we can start with Dr. Opitz.
Sure. Do you want me to say something? Or?
Yeah. So maybe just briefly touch upon how health security fits into those traditional security paradigms of hard security, essentially.
Oh, wow. That's a tough question to start and kick off with. First of all, I was from my side also saying thank you to have me again this year at the Young Security Conference. I remember last year when it started the first time, and it was such a unique and very special group of people and spirit. So I'm very, very happy that you managed to have the Young Security Conference this year as well. And I'm glad that, you have me there again. And even with closer, I'm very glad that we can support you on your journey. I remember last year when the Young Security Conference started it was in February, right? And it was the first COVID cases down here in Munich. And I touched a little bit upon this issue and the nexus, health and security, which is the nexus I am working at and we with Close are working at. And it's been a journey since then throughout this whole pandemic when it started, right? Basically right after the Munich Security Conference and then the Young Security Conference. Health and security is been a huge issue, and in both in the academic debate, but also in the practical field, right? In the academic debate, it's like a, how do I put this? It's there's these concepts of security, right? And even the term global health security is all around. And I'm not touching upon the academic debate right here. I'm going right into the practical issue. We are using this aspect, or this term global health security. What we are meaning is not the security I'm thinking of when I'm talking about security. Basically, when I think of security, and you said hard security, I think of fragile states. I think of a stable state system and a stable state and stable international actors and stable national actors in terms of states, and how health incident could affect these issues, or the stability and resilience of societies, right? What we are facing here in Germany throughout the pandemic, we are talking about like not hard security, we are talking about the stability of the health sector as such, the health system. How many beds do we have? How many patients do we have in ICUs, which is the intensive care units, and these kind of things. And what I'm missing in this whole debate is the link to the global issues. Still, we are talking about the global issue when we are talking about going on vacations throughout the summer holidays. We are not thinking of how our travel issues affect other parts of the world. And I think Christina and also you, Stefan, you have more practical input on this issues here. When the pandemic hits, for example, fragile states or states in conflict. We have seen this in, for example, Israel-Palestine in combination of the vaccination issue, right? Where the vaccination issue becomes a political issue regarding to the conflict. We see these issues also, and this is something that haven't seen at all in the debate in Germany. When I think about Syria, for example, where there is no health system existing, and we do have a war going on, and a pandemic, and a migration issue. So this is an example also for the nexus of security and health. I'm thinking of Afghanistan. Stefan, here again, you are the expert. You have been to Afghanistan. The international community is pulling out of the country. The Taliban is taking over. Also you, Christina, you might touch upon this. There's a conflict going on. And for sure, the Taliban will not at all think about COVID-19 or getting this pandemic to an end in Afghanistan for those people who are actually affected. So these are just small examples on this nexus, health and security in terms of the pandemic. If I think on other health issues that have not so much to do with pandemics, then it's exactly this issue of how, how do I put this? How health sectors or the health system is used as a, let's say, tool to do war. We have seen that in Syria, where the international, not the international community, but the different actors on the field threatened the health system, the bombing of hospitals, the killing of doctors and so forth. They use this as a tool to do harm to the society, as a tool of war. This has been something new over the last years. And that is why the security aspect of health needs to be, from my point of view, discussed in a different way than we do it in the global health community, if you will. The global health community is talking, as I said in the beginning, about security in terms of how stable is a health system. They are not talking so much about how can we work together with the military, for example, in order to get stability in the field and stability in the health sector together. So this is something that is missing, and this is something that actually also it's missing kind of in the debate when it comes to European security and defense policy, right? So these are just brief thoughts on this aspect, because we have two experts here that are in the field and can tell you more on the examples that I theoretically touched upon.
Thank you for that. I would definitely love to hear from the experts in the field about their thoughts on the health and security and the nexus between them. So perhaps we move to Ms. Strassmayer and then Dr. Goebbels, please.
And thanks, Anja, for your inputs. Yeah, I think you set the tone already in the right direction. And I'm just going to talk briefly about what was just mentioned in terms of the direct and indirect impact of COVID-19 on political stability overall and conflicts. I think I'm going to start with the political impact, because it's more the direct one that we have been following and monitoring. And it's even something that you can see in Western societies, where you had increasing pressure on governments, how to respond to this crisis. We have, for example, already a commission of inquiry going on in the UK against, or to understand how well the government was prepared for the pandemic. There is a similar class action going on, for example, in the Lombardy region of Italy, where the pandemic had hit initially and very heavily. So it is something I think that will also have, even in Western societies and political systems, still a lasting political impact. Even like radicalization movements and people just spending much more time at home in social media, all the effects of social media that we know of, the echo chamber effect, is something that already was very early on recorded as something that increased during the pandemics. When we leave that context of relatively robust democratic political context, the political impact primarily manifested in a perceived or also a real exploitation of this pandemic by political systems or by governments to ensure that they stay in power. One very strong example is the case of Ethiopia, where elections were postponed. They were supposed to be held in September last year. They were postponed, and this was perceived. The official reason was COVID-19, the pandemic, and security and health issues. However, that happened in an already very contested political context, and parts of the Tigray region specifically pushed against this narrative and said this was only to extend the mandate of the current government. They went ahead with unilateral elections in September, which kicked off a massive conflict in which starvation even is potentially used as a tool in that conflict, and we are facing currently a risk of famine across this region, and several hundreds of thousands of people are likely to be impacted of that. And it's very questionable whether, because the pandemic was a real issue for Ethiopia at the time, it still is. However, it did trigger, and this postponement because of the pandemic did trigger a counter reaction that again led to a massive armed conflict right now that is not only affecting Ethiopia as a country, or even the affected region is threatening the entire stability of the country. It's impacting neighboring regions. It's potentially becoming or it is already a regional conflict, with Eritrea, for example, being part of the conflict already. And that's similar cases, Somalia, where elections have been postponed, and that did lead to tensions. And this is more the very obvious impact that COVID-19 had. And then I think there is a more, going into the economic impact sphere. And this is where I think things get a lot more intransparent and also a lot more long-term. And I think we are currently at a risk that we really lose sight of the impact of the impact that the economic effect that the pandemic had will still have on political stability in the future. And to sum up this economic impact, it's primarily that a lot of people, and we're speaking here about millions of people, probably we can never even count how many people lost their incomes because of the movement restrictions, could not go to work. And as you know, most of the world is not working, or it doesn't have the benefit of a contract that pays for them if they do not show up for work, because there's a pandemic. There are no social welfare systems that cover for that. But if people do not go to work tomorrow, there will just be no money as of tomorrow to feed not only their own families, but even families, especially of migrants back home. And so the loss of remittances is a massive extension of these of the loss of salaries in the first place. And we already see massive or large-scale movements of migrants going back. Started very early on in the pandemic, but we still see them just because people are depleting their resources. And from the Gulf, there have been huge movements back to all of Southeast Asia, all of the migrants workers that are coming from there. And the same time, even a very interesting case, because Anja, you mentioned Afghanistan, just as of during the pandemic, over 1 million people came back from Iran and from Pakistan, Afghan migrant workers, that are now coming back to the country because they lost their jobs, they lost the resources they had to stay afloat for some months. They lost their work visas, which is usually always tied to many countries to employment. And they're coming back into a context that is so incredibly fragile as it is right now with the withdrawal of foreign forces. That is practically completed and officially will come to an end on September 11th. And then the second just final point to add on the loss of incomes, that a lot of the programs that allowed migrant workers to leave their countries to other countries are based on often some kind of government incentive to do that. Or families also save for many years to be able to do that. Again, the governments currently also do not have that money to launch similar programs again. So it would be very hard now for people to actually go back and take up again and their work. And the second main point I wanted to mention with regards to the economic impact is the effect of the plunge of oil prices. And many governments in the world do depend almost entirely or to a significant share of income from these resource revenues. And basically those stopped very rapidly early on in the pandemic. And this did affect their ability to import food, because many of these countries do have to import food. South Sudan is a very strong example where 90% of the budget is depending on the oil resources, and at the same time it also is by 70% importing its own food. So again, here you have a strong nexus between, again, from the pandemic, the economic impact, and then an impact that actually does affect the health of people, because in these countries it doesn't mean luxury products to eat, but it means really basic nutrition. And to conclude my initial remarks is that this economic impact is still going to have effects on the political stability of the countries. In fact, there is a very interesting paper by the IMF that showed that the impact on political stability and civil unrest as a result of such major economic shocks comes around 14 months after the end of the shock. And we do not even really know when the end of the shock is. But I mean, even assuming that it would be now, we still have over a year from now to account for, until we see, for example, this shock to translate into major political instability. Could be triggered by the elections that are happening in some countries. There could just be happening because of other immediate triggers, and we do not, or we lose track in the meantime that these are still linked to the pandemic. And yeah, this is why I think that the topic is more than relevant, because there is still time to create the awareness for these links, and to also discuss measures how to respond to these multiple direct and indirect effects. Thank you. And over to Dr. Goebbels.
Okay, thank you very much. Yeah, when I'm thinking back of I think the last conference where I was able to present in presence, that was at the end of 2019 at the Konrad Adenauer Foundation, and we talked about the nexus of health and security during that communication. And it was a lot of experts sitting at the table, and in the end we were asked if there is really a nexus between security, health, and economy, because some of the participants couldn't imagine that a health crisis could involve economics or security. And unfortunately, the last 1.5 years gave us a chance we didn't ask for, to see that our thoughts and also what we thought is a threat to the entire world is right. So we did not predict it, but we thought there might be a time where the disease X will hit us and will show us that there is an influence. So the best example we had before we started talking about COVID-19 was definitely the Ebola outbreak in Africa. And already what you've seen there on a much smaller scale, if you are talking in numbers of involved people, because currently the entire world is involved, without, I think, a doubt of a single person that is not involved worldwide. During Ebola, it was not. But already what happened there by closing a border, I think you all know how many people in the area that are working on the other side of the border are not allowed to work on the other side of the border when it is closed. So, and there is no insurance that will cover them. It's just the information that I'm not able to feed my family. And Christina, you've touched this already, but in a very, very personal way, if a government, or if, for example, WHO recommends that you should close the border, the economic impact is massively. And we don't have to look for Ebola in Africa. You can look at the country that is behind me, because that was the building I was able and allowed to work for 4 years. What happened to the United States of America during the last 1.5 years, or the first 1.5 years during the COVID crisis? It was definitely not the case that the first reactions of the federal government was because there were a couple of infected people. It was because the New York Stock Exchange has fallen by 7%, and they've seen an impact on the US wealth and health area, you could say. So that was the first reaction that was coming by the US. If you look back a little more, you could have seen that there are 2 countries in the world that were declared as the one that were had the most resilience to any kind of such a epidemic or pandemic disease, and that would have been the USA and Great Britain. Why do I tell this so specifically? Usually, we have something that is called a standard answer, or it's a standard workaround through problems. If we have a problem in Africa, we can rather send people, we could send money, we could send resources. And okay, I'm a military person. If necessary, and for example, by the Security Council mandated, we also could send people with guns, soldiers, to do peacekeeping. All this was not possible anymore because the entire world was involved. All the resources were drowned by the home countries. So the natural reflex that, for example, you could ask, we have a problem in the Western Sahara, asked France predominantly, asked Great Britain, asked USA. It was not possible because all these people were in the situation that on their home front, at home, they had the same problems than the African countries had. But unfortunately, they've gone a step further. Some of the more richer countries offered high money prices or high money to unemployed healthcare workers in African countries to bring them into their countries, and even made the situation in the home country worse. And talking about security, because the major part of what I said was more or less into the economic way. It's the same. We have a standard on how to answer, but unfortunately, in certain situations, they do not work anymore. For example, I think Anja, you said this that a couple of unfortunately too many healthcare facilities were bombed by, no, not unfortunately, by, I'm looking for the word, sorry, on purpose, to destroy a certain resource, which is one the people really need for living, especially in areas where you have warlike scenarios. On the other side, when you have a pandemic disease going on, also the standards for peacekeeping, for example, were not possible anymore because you have to protect your soldiers. There are currently 100,000 blue helmets in 18 missions. Do you think the missions could do their job like it was planned? Unfortunately, not. So we have dozens of examples in currently all countries of the world where the situation by a health crisis influenced economy and security. And coming back to the US, the last example in this definitely was the riots. I know that the riots were inducted more or less by the killing of a black person by a policeman. But the situation already was inflamed in the entire country. The reaction of the government made the people, brought them to fury, pure fury. And it was just the last ignite. And you could see that also after the riots have stopped, the number of high criminal murderers, homicides, and all that others have increased, not only in third, but also in second and first world countries. Should be enough for the introduction, I think.
Indeed. Thank you for all of your insights. It's actually very interesting to hear the different ways that health security, or at least health, global health, has impacted security traditionally, but also in different ways through the economy. And just touching upon what you said about, Dr. Goebbels, about the standard workaround, and my question is about what are some ways that cross-sectoral cooperation has had to change from the standard workaround to respond to this pandemic? And all of you are very welcome to speak about your insights about the cross-sectoral aspect of this pandemic.
Who wants to start?
Stefan.
Okay, so yeah, cross-sectoral. The main thing that cross-sectoral for me is definitely that I have the security or defense perspective, and also I have to work with the global with the Ministry of Health in Germany. First of all, we have a lot of cross-sectoral support, because one of the resources that you could always use in pandemic response is as the military. So currently, I think 6,000 soldiers are purely working cross-sectoral because they don't do defense of the country anymore, or a peacekeeping project. They are currently in vaccination programs. They do COVID response, and that's only one of the examples. When you look from the perspective back again to New York, United Nations, we've seen a lot of issues. As said, all the standards were not possible to perform anymore. So we had to talk with a different kind of resources in governments in Africa to support us. Usually, simple example, our soldiers need blood, and when you send this blood from a certain country, because it can't be produced in Africa, you have to ask for the import regulation, and even if it's a humanitarian thing, that was closed during the COVID-19 restrictions. So we couldn't get anything into these countries. And now we had to talk to the External Affairs Office. We had to talk to different parts of the governments At least in this country, don't want to name it, we even asked the the president of the country, if we were allowed to get some humanitarian products into his country to support our troops and also to support the population. So from my point, only some examples. I think the more the policymakers are on the other side of the table. So I would hand this over.
If I may, Stefan, I remember when we first met a couple of years ago in Hamburg, right? It was before the World Health Summit in Berlin. And we actually, the reason why different people came together at the Federal Staff College in Hamburg was the cross-sectoral issue on the topic of health and health security and all that nexus. And we were talking, I remember that lively because we had hardcore discussions, let's put it this way, between two ways of thinking. Those people who are totally into the, I would say, development policy field, who are sometimes because of their political agreements or because of their how do you say, their way of working in their non-profit organizations and stuff like that, and their fear of even touching upon the security sector and even touching upon, even think about working together with military people, for example. And now when you think back of what Christine just mentioned, how health issues and major health issues could affect especially fragile states, I think, in today's world, as I said in the beginning, it's still for me kind of putting my blood pressure up that we are still so narrow focusing and not talking about, I would say, honest and real cross-sectoral issues regarding these aspects. It's the same with climate change, for example. It's getting a bit better at security and climate change nexus, but it has been a way. And now we see the same thing with health and security. And by the way, because of that meeting back in 2017, it was the origin of, founding the Global Health Security Alliance, because we are a bunch of people from the different sectors working on the issue. And I mentioned this because I want to share a quote of one of our colleagues who is working with COVID patients in Paris. He once said, the crisis that we see right now is not the coronavirus. The crisis is the lack of knowledge of parameters and indicators. And that brings me to my point, because another colleague of us working, she comes from the veterinarian sector. She said the crucial thing is identifying threats before they spill over to human being. What we are seeing here with the pandemic is exactly, you mentioned it, Stefan, a kind of disease X, a zoonotic disease, which is originates in the wildlife and then spills over to human beings. And again, remember, what we are talking about in our daily discussions covering this pandemic, there is no future thinking still. It's in the bubbles, in the experts bubbles, but it's not in the public debate. So I said the most crucial thing is identifying threats before they spill over to human beings. We need a development of kind of a cross-sectoral indicator system and surveillance system, which is not existing at all right now. Especially animal surveillance is the weakest link when it comes to health issues and pandemics and epidemics. And this actually links also to aspects of climate change. Why? Climate change basically is the biggest booster for zoonotic diseases. it's climate change and globalization, which boosters and fosters increase of animal and human being contact. It also climate change changes the habitat of wildlife globally. Microbes develop complex survival strategies and becoming resistant, kind of something that we are discussing when we're talking about whether or not our vaccination is working or not, but I'm not a vaccination expert. Climate change also fosters the aspect of so-called thawing agents that leads to mutations and unknown pathogens that will become potential threats and disease X. By the way, disease X is the term that is used to describe something like COVID-19, which describes something that occurs somewhere where we don't know it occurs. We don't know when it occurs. We have no vaccination. We have no medication. We have nothing, and we have to deal with it, and it spreads globally. So this is the scenario, disease X. So the most crucial thing is, in terms of cross-sectoral cooperation, is a surveillance system that needs to be established globally, where we can actually identify these threats before they occur and before they become a pandemic. And that means we can, of course, and we need to find extra actors who have the tools to basically help. It could be aspects of digitalization, right? The IT branch, could they develop indicator systems that could help? We need to cooperate much more with the environmental sector and with people who are experts in animal surveillance, because they know what we need to look at all in order to identify threats. We also, again, here comes the nexus to the military, might work with their intelligence systems in order to establish these indicator systems. And here, Stefan, you are the expert in that. So pandemic, touching my last point here, touching the economy sector, and this is also a cross-sectoral issue. When I look back at the world, if you read the report, what's it called, the World Economic Forum releases a report every January. And when you look into this report in the last years, what you see here is that there always was mentioned the impact of a possible health threat like a pandemic on the economic sector. It was mentioned as a, let's say, possibility of a high impact to economics. But if you then look at this, at the report regarding the question, would we see this scenario as a possibility within the next year? Pandemics wasn't on the paper anymore. It wasn't mentioned anymore. So the risk assessment that was done over the last years was wrong. And when I look into what we are doing right now, or how to, in terms of the discussion to get out of this pandemic, and I talk with the economic sector, and when we do webinars and seminars with them, the risk assessment is still wrong. They're focusing right now on getting their businesses out of this pandemic. They're not thinking at all, and I'm generalizing here. There are of course businesses who do that, but most of them, they're not adopting their risk assessment on the possibility of these hybrid threats in terms of health issues. And pandemic risk management needs to be an integral part of any business model for the future, because the next pandemic will not hit us within the next 40 years. It might come in the next 5 years or in the next 10 years. And by the way, Bill Gates is the one who always warned about these scenarios. He said we need to prepare for the next pandemic as we prepare for war. And that means risk assessment. And it's still not done. And, you know, since this is the Young Security Conference talking about European security and defense policy, look at what the policy issues in the field of CSDP. When it comes to missions and operations, CSDP missions and operations, what is done in the medical field is, how do I get my people that I, you know, employ in the mission in the field safely in terms of health? It is not mentioned the aspect of, could a CSDP mission, for example, be deployed within a pandemic war scenario? Let's put it this way, where you mentioned Ebola, the Democratic Republic of Congo, right? Where we have a war in the north part where Ebola broke out. Are our people prepared, the civilian missions? Are civilian people prepared not only to take care of their own health, but what do they have the risk assessment mindset when they are deployed abroad in terms of tackling pandemics? And what I mean here is we have the international community deploys so many people. The UN does, the EU does, the NATO does. Can we use these resources as part of a toolbox for these identifying threat system that needs to be established? A question that needs to be asked from my point of view. Yeah, I leave it with that.
I can just add a point which you just made me think of. Is really the risk analysis, and since I've been working largely for my career as a risk analyst in different sectors, but always in that function, I think it really hits, I think, the point, and also I would say probably frustration of most analysts that have always the challenge to communicate and to convince operational stakeholders that the risk analysis has to be done before you think about the response, right? And something that I have been thinking about a lot over the past year, and you've also mentioned it, and just wanted to share that a little anecdote, I guess, is so I started in the risk advisory and risk analysis world in the private sector, so consulting companies to prepare for crises. And this was obviously many years before the COVID-19 pandemic. But so the consultancy I had been working for had experience in dealing with preparing companies for a pandemic, because they had been operating in Asia, and they had been through the swine flu, through other coronaviruses before, right? So the mindset, if we went to, for example, a company to consult on their risk matrix and their identification of risks, that was one of the points that would always come up as a feedback is, have you thought about a pandemic, right? However, because of that experience of having been through it as a company that helped business deal with the impact and management and future preparation, and so since the clients, however, were mostly then European and German, in that case German companies, who often never had that experience, the rejection of preparing for pandemic was massive. It would never make it to any internal risk matrix, to any crisis preparedness plan, because it was so abstract, right? And it's such a human, I think, such a human case, and because we are falling, basically the reason why I think a lot of this is happening is because humans tend to have incredible biases. I mean, we are able to analyze, that's a good thing, but we're incredibly biased when we're doing it, right? And so we tend to usually see the things we've already lived through, right? And however, in addition, and I think this is also is being discussed as we think about, well, what other Spanish flu happened, but not even too long ago. However, zero or very limited public awareness of this massive event, and there are different examples of why that is the case. But one argument is also that that humans not only are very biased when it comes to risk assessment, which is why you need professionals to help with risk analysis, but also that we are specifically biased when it comes to deeds or to risks that are not human induced, which is exactly the pandemic, as you just mentioned, Anya, and basically being at least the primary trigger or origin coming from nature, even though obviously it links to man-induced or will potentially even increase as it links to climate change, which is a human-induced fact, which even that we have issues to acknowledge. So I think that is for me is a huge issue to even for the future, because again, unfortunately I have seen how resistant how high resistance can be to risks, and also thinking even beyond that, because just the repetition of the past risk, even a new pandemic will most likely will not be exactly like the one we had before. And going the extra step beyond and really thinking about what could be next time, no? That would be, I think, still a huge challenge for any kind of future preparedness.
Thank you.
Yeah, let me add something, if I may.
Please.
When I had the opportunity of going to the university again and do some economic studies, one of the first sentences I learned during that time is, don't try to improve efficiency and effectiveness in one step. Unfortunately, effectiveness was in the last 20, 30 years in the security, and also not in the health chapter, the most forthing things for us to do things. It was efficiency. So if you could see that 20 years ago, or 10 years, even 10 years ago on the security level, it was the same, like talking about my country, Germany is surrounded by friends, and we were doing some crisis interaction missions where we went to Afghanistan. Compared to what we're thinking right now, and what also Europe and NATO are thinking right now, that's a small size operation. We're talking about larger joint operations right now, because there has been some risk analysis that maybe we are not completely, and not for the entire future, surrounded by friends. So this risk analysis changed in the security level something. I see a very strong parallel to what happened after COVID-19. We thought of health issues for a century, and you managed the Spanish, or you talked about the Spanish flu 1918, 1919, which is was the third largest pandemic ever, between 50 million and 110 million people died by this disease. And I could talk an hour about what happened during that time and was called Spanish flu, but I think you will have the time, if you haven't, to find that out by yourself. But we've seen right now that a health issue is not a regional one. And we could see that not only the military was reduced to pure efficiency in so many states around us. Number of soldiers was decreasing and decreasing and decreasing, because they're probably enough. You do smaller missions, you try to help some countries. You can do this by burden sharing with 29 NATO nations. And so a number of soldiers was reduced. The same we've seen in the entire European and area. I'm talking about hospital beds. You're not so long anymore in a hospital bed. We don't need those beds anymore because they're cost intensive. So the same is with storage. What happened in the first couple of months of the pandemic? Nobody was able to buy masks. Also, not toilet paper, but I don't want to go there. So very effective countermeasures were completely limited because storage costs money and stockpiling costs money. And we decided that we don't need it because we didn't need it for decades. Now there was a time where the entire world needed it, not only masks, but also ventilators. It was not possible to get ventilators to a country that was only equipped with 2 for the entire country. How do you want to support these countries? How do you want to build up surge capacity if there is no surge capacity? And that's something I can say about the military area. Not only talking about guns and tanks and rockets, also talking about the countermeasures for any kind of bacterial warfare, a pandemic, whatever you can create in your head. We've seen that stockpiling was completely underestimated during the last decade, and that needs to be changed. And the military, in this case, to my opinion, is only an example. Also, the entire health system needs to be prepared for the next one. The health system might be a little more resilient right now after the experience, but we will forget this within the next decade. But the stockpiling system, which was a massive thing in the post-Second World War time, was completely forgotten. And that was something that the price for giving how to stockpile was an expensive one for the entire world.
Okay. And just touching upon this need to have the appropriate equipment in all the countries. I remember in, I think it was the mid-2010s, where after the Ebola crisis, there was this G7 meeting, and they came up with the Global Health Security Agenda to be a sort of digital platform to monitor, the equipment and the funding and donors and everything like that. And instead now, I think now what's coming about, like there's a lot of talk about, a pandemic treaty, for example, or these different avenues of addressing this from a multilateral perspective that really don't build upon maybe the Global Health Security Agenda. And I'm just wondering what your thoughts are on that, all of you. Perhaps I pick on someone to start then. Maybe Ms. Strassmayer?
I actually would be very curious to hear what my two colleagues have to say about this. And then maybe I'm coming up with some smart thoughts in the meantime. But yeah, over to you guys.
What I think I have an idea because, or step in here because I want to make a quick note on the stockpile system that Stefan just mentioned. The good thing is the EU started to work on a stockpile system, at least for the European Union. And it would be a very good thing to actually don't lose track on that development, but that just as a side note. In terms of multilateralism, interestingly, the Global Solution Summit this year in Berlin touched upon this issue a little bit. And I found it very interesting to hear about the debate that has been going on in this community, because the Global Solution Summit is basically, there's like major actors there, other than, for example, on the Munich Security Conference, are the African countries and the African Union and so forth. Anyways, what was mentioned there is that multilateralism, or putting this issue in the multilateral context, needs a general global community to support these issues. And the comparison that has been made was climate change, right? Doing preparedness, doing prevention, which is basically the crucial aspects of being prepared for the next pandemic or the next major health issue is prevention. But prevention is the most tricky part of it, because, as Stefan said, it costs money. And to actually, political actors are mandated for a very short period of time. Prevention is a long-term aspect. And to compare these two aspects with a money issue in terms of, making money available for 10, 15 years to develop something is something that is very hard for a politician to establish in the political sphere, I would say. And that's why I really agree with this idea that it needs a general global community to support the political actors in order to do their job on the political level, right? So it needs I would say, as first steps, what we need to do is to foster a better risk communication within populations. And here the comparison to climate change would be, is the population aware that whatever we do today in our very personal behavior affects the climate aspect in the future? And the same as with health. Are our populations aware of whatever they do right now is affecting health in the future? So if I'm having the aspect of antimicrobial resistance, if I'm having a flu or a cold and I go to the doctor and he gives me antibiotics without even asking what I really have as a cold or a flu or whatever, is that the right approach? Because in other parts of the world, antibiotics are desperately needed and people have no access to this medication. And in our part of the world, we are kind of throwing antibiotics throughout the population, which leads to resistance. And resistance actually fosters the next epidemic or maybe pandemic because of mutations or whatsoever. So yeah, risk communication is something that has to be fostered, I think, in order to have this multilateral debate. It's two levels what I'm talking about here, because I'm starting at the community level and the society level, but they are the ones who actually foster then the multilateral cooperation on the political level and multilateral level. And when I come back to the EU sphere or the European Union, if there would be a stronger risk communication within the EU community in terms of health, meaning the understanding that the health crisis that we are facing right now is not a national issue, something that you have heard probably or read in the newspapers, but it's a very crucial thing when people say a health crisis like this, a global health crisis, is not a national issue. And what is missing on the EU level is that the EU has not yet the competence to do health regulations on the EU level. It's the member states. So if we would have a community and a society within the European Union and European Union member states to actually understand that this has to be an EU issue that is done in Brussels, it would basically help the political actors to actually support that in the Brussels bubble, I would say. Yeah, I had another thought that I just forgot. And so I hand over to my colleagues and think about what I just wanted to say and then step back.
Okay, so 1 and 2 inputs from my side. First of all, what was mentioned rather often is the term communication. Honestly saying, I've seen a lot of improving communication during COVID-19. And that's rather promising. Unfortunately, we're not there where we need to be. But let me give you an example. As said, I was in Afghanistan rather often, and I was there for NATO. So I was a multinational governmental-like organization. There might be a legal term for this, but I don't know it. But you get the point. Inside Afghanistan were a lot of non-governmental organizations working partially, I have to confess only partially, in the same direction than the military did. I definitely understand their position, but there was not at all a communication between some of the major non-governmental organizations and, for example, me being the head of the largest hospital in northern Afghanistan for 1,000 per 400 kilometers. We improved this over the while, but I know and I understand that non-governmental organizations sometimes need to be impartial and need to stay away from the military. But let's compare this to the situation when we have a global situation that is not war-like, a not warlike scenario. We're talking about COVID-19. It doesn't differ between a soldier and a non-soldier, and it differs between age. We all know that, but it does not differ between your job. And in this case, we started to have much better communications. Let's talk about non-governmental organizations like the Red Cross or Médecins Sans Frontières. For the very first time, we were able to share information. They have thousands of vectors. We were able to share information with them. That's definitely a good start, because the resources we're talking about in this pandemic view, they are not endless. Wasting them because not having the proper information at the right time. So the question is, how could it be coordinated that the communication is getting better? And let me go back to the example from 2014. It took almost the situation that we were at the point where the outbreak began to be a global issue, when there was the Security Council of the United Nations involved. That was a very late stage. And if you compare to the resolutions that the Security Council has made during their history, it might be about 6,000 of them, 3 are about medical topics. Definitely WHO is in the lead of this, but the communication between from my point of view and what I've seen, communication between WHO and the Security Council could be definitely improved to get more resources from the New York side to Geneva, maybe to support some international or better said, global issues. My part. Christine?
Thank you. I think I just have something to add on the point, I think, of what Anja was already mentioning, is the point of political stakeholders being able to occupy themselves with this topic. And going a bit back to what I mentioned earlier, the fact that it has been very difficult to communicate the risk, or to ensure that private companies are preparing for pandemics. The main argument why this should be done, or why in general private entities and companies should prepare for risk and should have their own individualized risk matrix, a response plan, is not just because they are supposed to be, just because for the value itself, but because there is legal regulation to do so. And the main argument has always been that it is to have such kind of preparedness plans, risk identification is not only is mandatory due to legal procedures, which are required by stakeholders. So if you're a company of a certain size and registered at your stock exchange, you will fall under certain regulations that require you to have these prepared measures. And I think what is interesting is, and again, this is one of the reflections I've been having, is if this is the case for private companies, clearly for political systems or for governments, the logic would be quite similar. And in general, it is, no, that the state has a certain, I mean, depending obviously on the system you're living in, but does have a certain foresight and caretaker role for the respective citizens. So and I'm wondering how that the issue with health crises is that it's not yet a demand, or not anymore a demand by populations. And again, I'm talking here specifically, I mean, the countries that can even afford any of these preparedness actions, but maybe also more broadly, that it has not been something that it is a political demand, political parties and governments maybe have to respond to, because we have not been threatened yet by these major health crises. So I'm wondering also if here the mechanism is similar again to the economic or the private sector field, where the preparedness, and I think probably climate change is having maybe a similar trajectory as a risk to entire populations, that it is becoming increasingly over the past years a demand by not all voters and people casting their vote in the end of the day, but a certain group of people that will be more affected in the future than others, because they just have a longer life expectancy yet. So yeah, I'm just, I thought it's just a broader reflection on linking what Anja said to enabling political stakeholders to have the resources to occupy themselves with this topic, but at the same time, this being I guess hopefully becoming a stronger demand by populations of their political representatives in the future.
Thank you for that. Thank you for touching upon how important communication is to preparedness, and how preparedness looks different in different countries based on capabilities and what's available. And sort of relevant, but also switching gears a little bit, for my final question before I turn to the audience, is about COVID vaccines, and specifically looking at a huge part of that journey is COVAX, and there was a lot behind that, but it's turned out that certain vaccines that are administered aren't approved for different borders, and that still harms those economies and the populations within the countries being administered COVAX. So I was wondering if you could give us your thoughts on that and your insights.
Yeah, vaccines is a basically an issue that is very much linked to the multilateralism issue. And I did this link because I remembered what I was going to say and add to my points to your previous questions. And I want to quickly mention that before I come to the vaccination again. We are focusing very much on the pandemic right now in our discussion. But what I want us also is to remember that health is a broader issue, right? And health is mentioned in, for example, the Sustainable Development Goals as a global good, which means the access to health, the access to vaccination, the access to medical treatment. And the concept of multilateralism in the political sphere has been challenged, especially in the last couple of years, due to the rise of populism and right-wing populism and all that. But there is no other way than doing global politics in a multilateral manner, because we are living in the globalized world and we cannot turn that back. In terms of health, that means and focusing on the broader issue of health, that means a much bigger investment into the resilience of societies. And that brings me to the aspect of vaccination. Vaccination is touched upon and seen globally as a consumption, as a consumer good. And that has to change. Vaccination has to be seen as an investment good for companies, for societies. And this again, against this aspect that vaccination needs to become a global public good, just as like health, not health, like health. Like this, we are seeing a massive shortage still on vaccination globally. Remember when we started our discussion, we talked about the disease X scenario, and combining that with risk assessment. If disease X is hitting us where there is no, let's create a scenario. Governments have invested a lot of money to bring states out of this current pandemic. Just imagine a disease X hitting us within the next 5 years, where governments and states are still recovering from this current pandemic. Christina, you mentioned it needs 14 months to recover, right? You said this in the very beginning. Would there be enough money available for the investment to develop research in order to develop a vaccine for this disease X? Probably not. And just imagine that, and just imagine that scenario taking place globally, meaning we have no vaccination within 1 or 2 years. That would affect the globalized world in much, much harder than this current pandemic affected us, because lucky us, there was research already done on the coronavirus because of the Ebola epidemic a couple of years ago. And that made governments or made it for governments very easy to invest in companies to develop actually the current vaccination. So to sum that up, the vaccination part, or vaccination at all, development of medical treatment and all that, needs to become a global public good that leads to multilateralism, that leads to investment, that leads to states and societies to understand that this is something a national budget could, invest in prevention measures. The EU, by the way, could play a very important part here as a global actor, because it can foster international cooperation, and it basically does, because, or it started to do so, because since a year now, the EU has started to use a couple of tools it has actually to foster this international combination within the external relation field of the EU, which means to activate the crisis management, the so-called crisis management tool in full mode, that actually allows EU member states to share data in this aspect. and data is here again a crucial part that is needed. We need data to develop medical treatment and vaccination. We also need data to be distributed and coordinated within the research field and the nation states. And also the EU has actually fostered throughout this crisis management tool kind of what they call a transparent system of epidemiological data surveillance, which sounds kind of freaky, but it's basically what I just pointed out. Data is a crucial aspect also in the field of creating medical treatment. Yeah, and that's my thoughts on this.
Yeah, I'd like to add something. I think one of the sentences that stands for COVAX is that nobody wins the race until everybody wins the race. You all, I think we are all kind of amateur epidemiologists. After the 18 months, we learned something about incidences. We heard something about herd immunity. Definitely, I would agree that this program of humanitarian vaccinations is desperately needed for the world. And I think it's already a success that we're something about 100 million doses were shipped right now. But I need to come back to the situation we are currently in. Talking about my country, talking about most other first world countries, we have now approximately enough vaccinations to do a herd immunity, to reach a herd immunity in a way until the end of the year. That includes several problems. One of them is not everybody wants to be vaccinated. They all heard something about messenger and are might be afraid of this term only, which is only the one part. The other part is you don't reach everybody. The third part is you can't produce enough vaccination for the entire world in a very short time. And so what happened is that most of the countries, of the rich countries, were able to start a vaccination campaign. And I think if the resources are high enough, COVAX will increase their impact on the world. One of the things you have to also keep in mind, I think you are all, or we are all epidemiologists by hobby, is right now that certain areas of this world don't seem to be touched or hidden by COVID-19 like some other areas. There are a couple of reasons for this, like the density of your population is very important, the middle age of your population is very important. It's rather important how much you travel, and it's also very important how prepared you were to react to COVID-19. That might not be as effective when we're talking about third or fourth wave right now. But if you look for the African countries, their reaction to COVID-19 was so much faster and so much more professional than it was for the entire first world countries. Giving you an example, by February 2020, I was still riding on my train to Grand Central Station in New York with 5,000 other people when I heard that I'm not allowed to enter the entire country of Uganda anymore to do some training there. The borders were already closed. People were wearing masks as much as masks were available at a time where first world countries thought, okay, we will solve this problem with all these big countermeasures. So till, I would guess, a month ago, most European countries were in a prioritization of their vaccination campaign still. So it was for those that are hidden by COVID-19 and are threatened by death. The elderly people, the people that are not healthy, the people that are working with COVID patients or healthcare workers. And now we are in a situation where we can spread the vaccination. And there, I think, the COVAX humanitarian buffer and the idea of a pandemic treaty comes into place. Unfortunately, within the first year, we didn't have a vaccine. And in the secondly, and I think it's maybe not fair, but it's understandable that most of the countries said, my country first, and now thinking about exporting their resources. Back to what I said, we were not in the situation that standards could solve the situation. And yeah, that's more or less it. I hope that we will hear about the COVAX program within the next years much more, because there are continents that needs to be saved.
Absolutely. Ms. Strassmayer, do you have anything to add?
Just a small point and a small just clarification, because I think that it's a really important point. The impact and the 14 months that also Dr. Opitz just mentioned is this is when we see 14 months after the shock, we do see an increase in political instability and civil unrest. So it's not even that this is the time to recover, but this is when we see this indirect impact that we cannot often trace back anymore. We forgot to trace back to the initial shock because it's a very indirect cause of causality that we have by then. So this just to give you, so yeah, just the longevity of this of the impact of this pandemic just underlines that. And then yeah, just to add on the, I think the overall the emphasis on multilateralism that I think makes sense when I to what the point I mentioned to the previous question, increasing preparedness as a political demand across by voters, by populations and societies, not only on a national level, but it's similar to climate change, I guess, an ideal topic that can be leveraged across borders. And at the same time, multilateralism during the vaccination, which I don't think I have to add. I think I'm also absolutely supporting it. This is the only the key, or one of the keys to solve this crisis, is that multilateralism also does prevent not only vaccine nationalism when it comes to producing vaccines for the good of your own people, but it does also counteract to then vaccines being used as a political tool to take influence, which is also something we have already seen with different vaccines being delivered to some states and not others on a bilateral basis. So also I just wanted to mention that point, that multilateralism in also during the vaccination process is key to prevent any, and to leverage what Dr. Opitz says, the perception of this being not a consumer good, but a basic right eventually.
Thank you for specifically highlighting the importance of multilateralism for vaccine distribution. There is a question from the audience which relates to this and also to the conference topics, and it's: to what extent do you think that EU strategic autonomy would be well or ill suited to respond to global health issues? Who would like to start?
try to spread some thoughts. First of all, strategic autonomy of the European Union is a term that is, was brought up right in the EU security field over the last years, and it's very strongly related to whether or not the European Union is able to run robust military operations, and we're kind of stuck in that discussion since the EU has its own security policy. When I started to work on CSDP issues, it was actually called ESDP, European Security Defense Policy. And I started to work in that field in 2005. And I can remember that actually back then, this discussion was already done. It was just called differently. And funnily, the discussion moved on basically on the same topics. Is the EU able to do something? And on the other hand, the world has changed. Security risks develop. They do not change. I think they develop and they change basically their manner. And right now we have a situation where we basically facing more what is called hybrid threats and interdependent bundles of threats, I would say. But the discussion still goes on, is the EU robust? And now there is this health issue coming up. And under the umbrella of global health security, the discussion is still not about health or what the EU has done or could do facing these issues. It's going back again on the 2% and the EU and NATO and blah, blah, blah. So what I wanted to say is that while we are discussing the same thing over and over and over and over again, we are not seeing what the EU is actually doing. So the EU, there was a lot of EU bashing last year when this pandemic started. The EU is not able to act. The EU has done nothing, la, la, la. And while the discussion moved in that direction, EU has done a lot of things. And all that under the, or against the background that what I said before, the EU system, let's put it this way, has no competence yet doing health policies, be it in the field of external relations, be it in the field of security, be it in the field of development policy, or be it in the field of health, to do it on the supranational EU level yet. When I'm saying this, I mean that the European Commission has no like basic legal right to implement a new policy or something like that. What they can do is they can use the tools they have in order to foster cooperation between the member states. And exactly that was done. The European Commission actually acted, and the European Council last year, they acted before the WHO called it a pandemic, right? In January already, using the tools the EU had. So I talked about the what's it called, the crisis, the crisis platform, which was activated, the crisis management system, which was activated in full mode. They also the crisis reaction response mechanism. Now I have it. That was activated in full mode last year. And that relates to the strategic autonomy question, because what the EU did here, other than other international organizations, Side note, the EU is no international organization, you know that. But the EU was able to basically start to coordinate measures within at least the European member states much faster than other international cooperation could have done that. And that basically is something relating to strategic autonomy, because if you are able to act, you're performing autonomously, right? What this response mechanism also made possible was the exchange of logistics, for example, between member states, which to unlock budget, I mentioned that already, and also to foster basically a kind of global governance in terms of, sharing information, sharing best performances, and all that stuff. So, and this basically, to sum that up, what I want to say is that if the European Union wants to reach a strategic autonomy, it's not that we need a master plan or a white book or something like that. The tools are there. We can kind of rearrange them a little bit in terms of giving the European Union at the EU level a bit more competences. And that brings me back to what I said before. We need the global or the EU community and society to actually foster the political process. And that will right away lead to more investment also on the military side, to invest in the military, to make money available for the security sector, let's put it that way. And that will all lead automatically to strategic autonomy. When you remember the last discussion about the cooperation between EU and NATO, it's already done. There has been a lot of progress made in these fields within the last couple of years after the release of the European security strategy, right? And there's, I remember there's one or two, I think there's two projects within the PESCO system that are related to health issues. And yet again, there would be, if I mentioned it, probably a lot of people would say, yeah, but the EU, is not investing too much, and there's NATO, and they are doing better things. We need to stop that discussion and focus on what the EU is actually doing. The EU is a global actor, and the EU has much impact, especially on the African country in cooperation with the African Union, where the EU is performing as a global actor. And to solve today's, let's say, security issues, it's not just the military part, it's the interconnectedness of different threats. And the EU has the toolbox to do so because it has civilian and military tools. And that is something that I repeat over and over again over the last couple of years. So to sum that up, strategic autonomy is all about changing again the debate on what we are talking about and what we are expecting about. And before we get lost in the bashing the EU system, we should actually focus on what the EU is doing. And we would be surprised how much the EU is doing. And I just mentioned a couple of things here. There's a lot more to that.
So I'd like to add another point. Maybe not starting from the strategic, even maybe not on the operational level, but on the tactical level. But that's the output of what is happening on the strategic level. And I can definitely declare I'm not a specialist for the EU. But let's talk about what you usually do as a medical doctor. When I drive in an ambulance. There are certain rules I don't have to obey during that time. And there's a light on my head, and there's an alarm going on that I can, for example, speed up on the street, that I don't have to stop at traffic lights. What I'm currently missing, but that might be just because I don't have the knowledge, is that the virus itself has shown that it does not, that it crosses border without a problem. But laws, rules, and regulations can't cross borders. So one of the problems we currently have in multinationalism, in working together, in burden sharing, is that there is no, I would call it, in case of law background or rules and regulations backgrounds that sometimes would allow us to do things that would be helpful for the entire continent. Let me start about one thing. I'm a German physician, which allows me to work in any case in emergencies and in non-emergencies in Germany. If I cross the Atlantic, I'm not allowed to do anything. Under certain rules and regulations, if I cross the border to France, to the Netherlands, I'm allowed to do something. But the entire international help is based on national laws. For example, the German armed forces had sent 2 doctors to the Czech Republic because there was a major outbreak in Praha. Unfortunately, they were not allowed to work on patients because national law doesn't exist, doesn't allow that. This is not only for personnel, this is also for transport. We are not allowed to transport certain things because national law does not allow this. So I don't know if this is a solution, and if this is going back to the pandemic treaty you talked about. There are certain in case of situations, maybe when the WHO has declared a pandemic because that's their job, that would offer us an additional toolbox where, for example, national laws are not so much boundaries. And I would expect to have the EU working on this, that international cooperation in these cases would have made or would have been made easier to perform. Thank you.
Ms. Strassmayer?
I think it's been very well covered by my colleagues. In the interest of time, I'm happy to hear more questions from the audience.
Of course. So another question from a participant is, has the pandemic promoted evidence-based decision-making in the field? And perhaps you could elaborate with your experiences as well.
I think, if I may, it's actually a question I feel I could speak to, and it speaks a bit to the I would say to the point I mentioned earlier about the challenges of doing robust risk analysis and leveraging these results to operational stakeholders. I think also, I think it was also said earlier that there was a big, not resistance, but the lack of understanding of the impact that the pandemic could have on other sectors that are not just the health system, right? As I mentioned, the economic and so on. And I can speak for a bit from the experience of working in the humanitarian sector and also in a UN agency, is that this has been the case, that there was no understanding how a pandemic could affect local economies and political stability, and then as a result cause major food crisis, and it took months to generate that understanding. And while, I mean, I would say I'm positive in the sense that there has been, this generated a lot of demand to conduct analysis under the COVID-19 lens. And maybe sometimes it's also, it's very overburdening, and sometimes you do not have a COVID angle to every aspect, even though in general, I would always obviously promote to consider and also to look for and make sure you're not overseeing things. And yeah, there has been a big demand in creating more analysis and hence evidence, I would say. But without sounding too pessimistic, I think this is not the first crisis that showed that analysis or risk analysis had been overlooked before and did not, evidence created through analysis did not inform primarily decision making, but other effects or aspects did inform operational decision making. So I would say from my perspective so far, the pandemic is often still behaving like other major, let's say, major shocks. Let's say a major financial crisis, like a major terrorist attack. That again there is no prior to that, or we have forgot about the prior, and it generates all these questions. Why haven't we seen this? Why haven't we done the analysis? And at first, a big ask to do analysis around this. However, again, when it then comes to keeping up the momentum and again, doing also the next step and investing in an analysis that goes beyond monitoring this past risk, but actually again, taking the extra step and looking for new emerging risks that are not on the radar yet. I fear in that sense, this pandemic the pandemic has not solved or is not behaving differently from other economic shocks. I would say, and I have lived through, let's say, other economic shocks professionally as an analyst to say that to compare this global pandemic to other major shocks to our systems. So, however, last positive note is, I would hope though that there was a bit of a realization that Stefan mentioned before that by now we are all kind of like at least by a small fraction epidemiologists and are trying to follow, and I'm trying to understand a bit that. And I have been happy to hear that some political stakeholders have mentioned after this shock that evidence-based decision-making is important, which, for example, maybe it's also a common a lesson learned from, let's say, decision-making after, let's say, a shock like 9/11. And that has not been evidence-based, but driven by other factors. However, I would be on the positive side. I would note that it's been interesting that at least, for example, for German government, for example, has made, and especially Chancellor Merkel has even said, this crisis has taught us how important science and how important evidence is. So for me, it's an interesting discourse or to have after such a shock. But again, with some doubts about the longevity of this of the realization, also because political leaders do change.
Yeah, let me point out the medical part in this a little, and I think we all we're in a kind of a dilemma regarding the decision-making process. First of all, sure, evidence-based is the safest thing to do. And we are all doing this because I think you all follow the incidences of your country, your neighborhood, your city. And the incidents are the evidence mostly for all the countermeasures we have. So most of the decisions were not incidence-based to be done, but that was the situation that we were living in. We didn't have any evidence. Medically speaking, we only had the evidence that there is, and that was done after the first month, that there's a virus and we don't have a cure. So you can't look for an evidence how to cure it. You just can have a good guess. You can have your education, you can have your training, you can compare patients. And by starting to have a good guess, to work with the problem, you are creating evidence. Right now, 18 months later, we know something that helps. We have evidence-based information about the vaccination. We know that being socially distanced is helpful. We all know that home office can reduce the incidences. But on the other side, this is evidence, this is the evidence-based. The other side is that we have to have a society running. And so sometimes the decisions are not evidently based when you're talking about the epidemiological side of it, because we would say as the medics, hey, let's keep on the lockdown for a little longer to be on the safe side of the house, which is absolutely understanding when you're a medic. When you're working in the tourism area and nobody can reach your hotel, you will definitely not understand this, because being suffered from COVID means for you that you can't feed your family. So there's always a right on the edge to decide on if evidence-based and also the information you have on the other sectors of the world. So is it an evidence-based medical decision to open up the Wembley Stadium for 60,000 people yesterday by growing incidences? Probably not. Is it maybe a good thing, thinking about 2,000-year-old sentence, panem et circenses, to keep your society stable because they can think after 18 months of something different? Maybe. That is what the politicians have to decide upon. They have consultants for this. But the medical part, we've seen that after starting with first experiences, we now can solve our decisions on evidence-based, which is much, much easier. But in a situation where you have, for example, 250 instead of 15 intubated patients in a New York hospital, there's nothing evidence-based. It's just trying to solve the catastrophe by what you've learned during your training. There was no looking back and learning from experiences or from data. Thank you.
Stefan, what you're just saying is basically supporting the idea, I would say, of multilateral cooperation, because there is a toolbox out there in the global world, how to, let's say, on how to kind of go through an epidemic or a pandemic. And the toolbox is that we know, what impact lockdowns can have at the very start of a pandemic or an epidemic, in order to in order to give a government or give a region time to actually develop or gain the data or the knowledge they have about the topic of what's going on. but we also know that lockdowns as a tool through a pandemic is not a good thing. And the evidence has been made in other countries that have dealt with other pandemics, such as Ebola or you know, the SARS pandemic and so forth. And you know, thinking that this a bit further is my fear kind of is, and that relates to what you said, Christina, that the topic of health or the topic of climate change basically, you know, leads to what the topic of security is suffering, and that is security policy is interest-based policy. And what you can see, for example, in Germany right now is that we have an election going on this year. And we have managed to go through this pandemic rather good, I would say. And since we have this election done or coming up now, we are kind of risking what we have achieved already. Because we are now in the discussion of opening everything up because we want to you know, we want to win this election. Like I would say, I'm generating right now, but what I'm seeing here is that it's understandable from a political science point of view that a political actor who is running or who is doing election campaigns or who is running a mandate, making a political decision making always has, you know, it is triggered by different aspects to the whole thing. Then and that differs from, let's say, a science-based decision making. However, we are talking about threats to society that or shocks to society that could possibly have a very long impact. And I agree with you, Christina, that a good thing about this whole thing is that in the German debate, but also within the European Union atmosphere, there has been a lot of campaigns that are supporting fact-checking, you know, and that are supporting the society to increase their awareness of fact-checking, which is basically evidence-based things. There has been a lot of a project of communicating, you know, different tools in the internet for people to be able to inform themselves, and then basically, you know, support on their community level, also the political level in that sense. And also the whole social media world has changed when throughout this pandemic and towards you know, a science-based approach, basically tackling misinformation and you know, all that aspects. So this, I would say, is the good part of this question. The other part is, you know, political decisions to some extent are also emotional decisions, especially when it comes, I mentioned the upcoming election here in Germany. So actually, when it comes to pandemic risk management, what it needs is what you said, Christina. It needs professionals who are not politicians to support political decision making to some extent. And I think this is something that we probably see in the future to be fostered in a much you know, broader way. By the way, we have seen this, right, Stefan, in the military sphere when it comes to the German Bundeswehr. Remember when this whole Afghanistan topic came up, and then within the Bundeswehr there was this position established called cultural awareness, whoever. Anyways, someone who is an expert on the region and who can support military decision making, if you will. That it fits into the region where the operation is operating, right? And I think this kind of happening we will see in the health community in the future more often, I guess.
I do have to interrupt because we are out of time, and I'm so sorry to have to cut this so abruptly, but I really do encourage everyone to keep engaging with the questions that we have from our audience, and also with the topics that our panelists have touched upon today. Through our hashtag YSC21. And I also just want to thank our panelists, Dr. Opitz, Dr. Goebbels, and Ms. Strassmayer for taking part in this conference. Thank you very much for your insights. Also, we will be, please stay tuned. Our next panel is in 30 minutes. It's at 6 p.m. CET. So join us for a discussion on EU and its neighborhoods. Once again, thank you.
Bye-bye and stay healthy.
Thank you for having me.